Respiratory therapists are on the front lines of this pandemic. Some say they're treating more ungrateful patients.
News 8 Now's Kate Overton is here with more of the challenges that they are facing.
Over the last year, respiratory therapists have been working with many COVID-19 patients to help them with their breathing. Staff shortages and ungrateful patients are just some of the challenges they faced during the COVID-19 pandemic, but that's not going to stop them from doing everything they can to save lives.
The last question that they ask me, the last two questions that they ask me before this happens is,
Gunderson respiratory therapist Courtney Snorick isn't mincing words.
I'll take the shot. I'll take the shot. Can I get the shot? And also, am I going to die?
She's seen patients at their worst during this pandemic. It's her job to help them breathe.
It's not only supplying the equipment that they need, it's also supplying a lot of emotional support for these patients.
The challenges are more than being short-staffed and long hours. It's also trying to get patients to take COVID seriously.
It is the number of people, but it's also the acuity, the grave illness of the patients, how much time we spend at the bedside to try to get these patients where they need to be.
Respiratory therapists say before the pandemic, patients would come in and they would help them for a few days until they got better. Now patients need help a lot longer.
It's not like the flu where you come in the hospital for a couple of days, you get your medication and you go home like nothing happened. You know, a lot of times people are here for 2 months when they have it bad, and even when they go home, they're never really back to their baselines.
Another challenge respiratory therapists have to face is finding a balance between helping COVID patients and other patients.
We're starting to see more COVID now again, but we're also seeing those usual patients, those chronic heart disease and lung disease patients that we expect to see on top of that. So the potential for large patient populations in the hospital kind of suddenly is really high.
Respiratory therapists that I talked to say many of the patients who end up in the hospital didn't get the vaccine and don't take the pandemic seriously. They stress that the best way to avoid ending up in the hospital is to get vaccinated and follow COVID-19 health and safety protocols.
All right, again, we've been talking a lot about this situations at both hospitals, and they're similar. Cases are rising.
Yeah, Mayo Clinic Health System says it's starting to see patient numbers rising near what they were last spring.